This exercise should be practiced by every woman because it is simple, effective, and brings surprising results to the entire body. By holding the position for 50 seconds, you improve venous and lymphatic return, which reduces fluid buildup and consistently decreases swelling in the legs and feet throughout the day. In addition, it stimulates better blood flow to the internal organs, supporting the function of the digestive and urinary systems, relieves menstrual cramps thanks to increased blood flow in the pelvic region, and boosts energy levels by positively affecting cellular metabolism. To perform it, simply lie on your back on a mat, bend your knees with your feet flat on the floor, and lift your hips until you form a straight line from shoulders to hips to knees. During the lift, engage your core and glutes to maximize muscle activation. Hold the static position for 50 seconds, then slowly return to the starting position. Repeat the movement 3 times on alternating days to ensure proper muscle recovery and avoid excessive fatigue. Studies indicate that the isometric contraction in this type of hip bridge significantly increases the tone of the gluteal and hamstring muscles, which improves posture and reduces lower back pain, according to research published by the Federal University of São Paulo in 2019. Additionally, a study from Harvard Medical School showed that isometric hip exercises increase local blood flow by up to 20%, explaining the sensation of lightness in the legs reported by participants. Beyond the benefits already mentioned, regular practice strengthens the pelvic floor, helping to prevent stress urinary incontinence, a condition that affects many women after pregnancy or with advancing age. Research by the International Continence Society revealed that weekly hip bridge sessions combined with Kegel exercises reduce urinary leakage episodes by up to 50% over a 6-week period. Another relevant aspect is the positive impact on the lymphatic system, since muscle contraction acts as an auxiliary pump that facilitates the removal of toxins and metabolic waste. This can lead to improved skin appearance, reduce cellulite, and strengthen natural defenses, according to a 2021 study from the University of Newcastle. To further enhance results, include a brief 5-minute warm-up by walking or marching in place before the protocol, and finish with 3 minutes of gentle stretching for the hamstrings and glutes. This way, you prepare the body, reduce the risk of injury, and aid venous return after intense contraction. It's important to maintain controlled breathing. Inhale through the nose and exhale slowly through the mouth during execution to ensure proper tissue oxygenation. Women who adopt this routine report not only physical improvement, but also increased mental energy as muscle activation releases endorphins, known as feel-good hormones, promoting a sense of lightness and relaxation. This combination of physical and mental benefits makes this exercise a powerful ally in the quest for quality of life and longevity. Finally, the recommendation is to perform this protocol 3 times a week, alternating rest days to optimize recovery and allow for muscular adaptation. If you experience severe discomfort in the lower back, reduce the hip lift angle or seek professional guidance. By incorporating this simple exercise into your routine, you will experience profound changes in circulation, pain relief, and increased energy within a few weeks. Before we continue, please leave in the comments where you're watching the video from, your age, and any questions you have. This exercise also helps release emotional tension stored in the pelvic region, as anxiety and unprocessed emotions often accumulate there. It's the classic butterfly movement, but there are essential details to enhance its effects and avoid compensations. To perform it correctly, sit with a straight spine, supported on a firm surface to ensure stability of the hip bones. Keep your torso aligned, then slowly bend your knees, bringing the soles of your feet toward your body until you feel a gentle opening in the inner thighs. Avoid forcing the movement. Let gravity do its work and breathe deeply, feeling each inhale and exhale expand the pelvic area. As an osteopath, I emphasize that it's crucial to monitor your knee position and breathing quality. Do not let your legs push your torso forward. The alignment must be maintained from the sacrum to the nape. If you experience discomfort in the pubic area or lower back, place small cushions under your knees to reduce the range, or rest your hands slightly behind your hips to ease tension. Each woman must find her own limit, respecting stretching sensations without pain. Controlled breathing is key. Inhale for a count of 4, feel your diaphragm expand and your hips open, then exhale slowly for a count of 8, allowing your legs to settle gradually into the new position. This breathing pattern not only intensifies the stretch, but also stimulates the parasympathetic nervous system, lowering heart rate and relieving anxiety. Building on the butterfly exercise we just detailed, tell me in the comments, had you already incorporated this technique into your routine? Did you feel more tension release in your adductors, reduced swelling, or even relief from menstrual discomfort when using different ranges of motion and guided contractions? Your feedback is essential for me to create content that further intensifies benefits without compromising safety. Comment which adjustment, narrower posture, gentle oscillations, or the contraction and relaxation sequence, challenged you most, and in which area you feel you still need more attention. Let's evolve together, one stretch at a time. Incorporating this adjustment into the butterfly movement 3 times per week, with sets of 40 to 50 seconds, enhances the exercise's analgesic and anxiolytic effects. Women who follow this protocol report reduced menstrual tension, a greater sense of calm, and improved pelvic mobility in daily activities. Maintain body awareness throughout the exercise, and if you feel excessive tightness, slightly reduce the opening angle or use additional support. This way, you maximize both physical and emotional benefits, creating a space for deep and transformative self-care. To deepen the benefits of this adjusted butterfly exercise even further, it's important to understand how various body systems interact during the movement. First, hip joint stability depends not only on adductor flexibility but also on the strength of the abductors and external rotators. Therefore, after the stretching phase, immediately include a strengthening exercise. Bring your feet together, press the palms of your hands against the soles with moderate force, and hold for 10 seconds, repeating 5 times. This counter-stimulus improves muscle tone and teaches the nervous system to better control range of motion. Moreover, core engagement is essential. While in the butterfly position, gently contract your transverse abdominis. Imagine a magic belt wrapping around your waist to protect the lumbar spine and optimize force transfer between the torso and lower limbs. A 2020 Mayo Clinic study demonstrated that conscious core recruitment during hip stretches reduces excessive lumbar spine tension by 30%, preventing chronic pain. Another advanced approach is to combine the exercise with proprioceptive techniques. Perform small lateral oscillations, gently moving your knees in and out by 2 to 3 centimeters, while maintaining an upright posture. This dynamic movement stimulates sensory receptors in the joints and muscles, refining pelvic balance and promoting greater neuromuscular coordination. Enhanced proprioception reduces the risk of sprains and muscle imbalances, especially in women who participate in sports like running or dance. For those seeking even deeper care, therapeutic ball self-massage can be integrated. After completing the 50-second isometric phase, roll a soft ball, tennis ball size, under your groin area, applying moderate pressure for 1 to 2 minutes on each side. This helps release trigger points and improves connective tissue elasticity, facilitating subsequent stretching. Research from the University of Melbourne indicates that myofascial release before stretching increases range of motion by up to 15%. Protocol varies according to biological individuality, but a good starting point is 3 weekly sessions. alternating rest days to allow muscle regeneration and avoid overload. To monitor progress, measure monthly the distance between your knees and the floor. A reduction of 5 to 10 centimeters in 6 weeks is considered excellent. Also record sensations of reduced pain or menstrual discomfort, as well as energy levels, to assess the exercise's emotional impact. In terms of routine integration, set aside 5 to 10 minutes upon waking or before sleeping to perform this sequence. Daily practice on an empty stomach, for example, enhances endorphin release and induces a mental calm before a busy day. Conversely, at the end of the day, the exercise serves as a deceleration protocol, preparing the body for restorative sleep, something supported by sleep studies from Stanford University that linked gentle nighttime stretches to up to a 25% improvement in sleep quality. Finally, always stay attuned to your body. If any sharp pain or tingling persists for more than a few seconds, stop and consult a professional. Personalization is key. Each woman has a unique combination of mobility and strength, so adjust angles, hold times, and supports as needed. Incorporating these variations and complementary techniques ensures that the butterfly exercise becomes more than just a stretch and transforms into a true ritual of self-discovery, pelvic health, and emotional balance. By putting these strategies into practice, in just a few weeks, you will not only increase your flexibility, but also build a solid foundation to prevent injuries, relieve emotional tension, and transform your quality of life in a lasting way. You can keep your legs wider apart if that makes the posture easier, but the essential thing is to keep your spine straight and fully relax your legs until your knees naturally drop toward the floor to the maximum stretch point. When you feel the ideal stretch, begin performing light contractions of the adductor muscles. Complete 30 to 50 repetitions at this measured pace. During each contraction, inhale deeply, and as you exhale slowly, focus on relaxing your muscles and fascia, allowing the tension to dissipate gradually. After completing the 30 to 50 contractions, I recommend holding the stretch for a few more seconds before returning to the starting position. This combination of isometric contraction, followed by deep relaxation, optimizes blood flow to the pelvic region and inner thighs, promoting more efficient tissue release. Systematic practice of this sequence improves hip joint mobility and reduces fascial stiffness, which is often responsible for lower back discomfort and a heavy-legged sensation. To further enhance results, include a brief joint warm-up beforehand. Slowly move your hip joints in wide circles in both directions for 10 repetitions before sitting. This warm-up activates the pelvic stabilizer muscles and prepares the connective tissue for the dynamic stretching stimulus. After the protocol, you can add self-massage to the inner thighs using a soft therapeutic ball, rolling from bottom to top for 1 minute on each leg. This technique aids in releasing hyper-tense points and improves skin elasticity. Controlled breathing throughout the entire exercise is essential. Focus on inhaling through your nose, expanding your abdomen and diaphragm. On the exhale, release the air slowly through your mouth while allowing your muscles to relax more and more. This breathing pattern activates the parasympathetic nervous system, promoting relaxation and contributing to a reduction in circulating cortisol. In terms of frequency, the ideal is to perform this protocol 3 times per week, alternating rest days to ensure muscle regeneration. Over the weeks, you will notice an increase in range of motion and reduced joint discomfort. To monitor your progress, measure the distance between your knee and the floor monthly, and record any improvement. Additionally, note the reduction of swelling and the feeling of lightness in your legs by the end of the day. Women who adopt this technique report not only increased flexibility, but also relief from menstrual pain caused by pelvic tension and an enhanced sense of mental well-being. The light contraction followed by deep relaxation releases endorphins and fosters an emotional lightness. Incorporating this routine into regular stretching is a form of stress self-management and promotion of intimate health. To deepen the practice further, try varying the width of your foot placement over the weeks. Start with the soles together, then gradually move them apart until you find the angle that maximizes stretch sensation without pain. This personalized progression respects your limits and prevents overload. If needed, use a yoga block to support your spine and keep your torso upright effortlessly. At the end of each session, lie on your back with your feet planted and slowly lift your hips into a bridge, holding for 10 to 15 seconds to stretch the posterior chain. This complement balances antagonist muscles and contributes to pelvic stability. By adopting these adjustments and variations, in a few weeks you will have developed greater neuromuscular control, improved local circulation, and a lasting feeling of lightness. Consistency is the secret to transforming pelvic and emotional health from within, elevating quality of life and overall well-being. Keep your legs as wide apart as possible, but most importantly, maintain a straight, aligned spine. Relax your entire torso and position your feet so your knees drop gently to the maximum tension point. Once you reach this limit, begin small muscle contractions, controlling the lift and descent for 30 to 50 repetitions. Inhale at the start of each lift and exhale slowly on the return, ensuring better fascial and muscular relaxation. Repeat this cycle 30 to 50 times. After completing the series, proceed to the active stretching phase to further prepare the involved muscle groups. To enrich this protocol and make it even more effective, add a brief isometric phase at the end of each set by keeping your hips elevated for 15 to 20 seconds while continuing to breathe in a coordinated manner. Recent studies indicate that combining dynamic contraction with isometry enhances glute and core activation and contributes to improved pelvic stability. A review by exercise physiology experts shows that the sustained resistance during these extra seconds stimulates deep muscle fibers that are not typically recruited by conventional movements. Relax your legs and wait until, simply by the pendulum effect, the muscle fibers stretch naturally. Stay in this position for 1 to 2 minutes, or for as long as it feels comfortable. If you experience a burning sensation or discomfort in the inner thigh area, resume the butterfly movement for 30 to 50 repetitions and then relax again. You may repeat this cycle up to 3 times, alternating contraction and relaxation, thus promoting a deep warm-up of the adductor muscles. To make this protocol even more comprehensive and effective, add some evidence-based muscle physiology techniques. First, when performing the pendulum stretch, focus on diaphragmatic breathing. Inhale deeply through your nose as you begin the swing and exhale slowly through your mouth at the end of the movement. This breath control increases tissue oxygenation and facilitates myofascial release. Then, during the active contraction phase, keep your torso upright and your hips neutral to better isolate the adductors and avoid compensations that could overload the lower back or knee. Studies show that combining dynamic and isometric stretching enhances flexibility and reduces the risk of muscle injuries because it recruits both fast-twitch and slow-twitch muscle fibers. To intensify the stimulus without immediately using external loads, try performing the butterfly movement while seated on an unstable surface such as a balance disc or inflatable cushion. This added instability activates the deep stabilizer muscles of the hips and core, improving proprioceptive control and neuromuscular coordination. Additionally, include a brief isometric phase at the end of each set, keeping your knees together and legs lifted about 5 centimeters off the floor for 15 seconds, which maintains continuous muscle tension, boosting strength and endurance gains. To safely integrate this method into your training routine, follow a schedule of 2 to 3 weekly sessions, always allowing at least 1 rest day between them. If you experience any persistent discomfort in the groin area, slightly reduce the range of motion or decrease the number of repetitions until you can perform the technique correctly. At the same time, include complementary hip mobility exercises, such as lying leg circles and lateral hip raises, to balance flexibility across the various hip muscle groups. Proper hydration and nutrient intake before training also play a key role in optimizing recovery and protein synthesis. Consuming a moderate source of protein and low glycemic index carbohydrates about 30 to 40 minutes before exercise promotes amino acid availability and energy, reducing early fatigue. After training, a passive stretching protocol held for 60 seconds in each butterfly variation consolidates increased range of motion and helps remove accumulated metabolites. Finally, track your progress over the weeks by assessing comfort levels and ease of execution. As proprioception and strength improve, gradually increase the number of cycles or the duration of the isometric phases. In this way, this simple method of alternating contraction and relaxation not only provides warm-up and injury prevention, but also serves as a powerful tool for strengthening and functionally preparing the adductor muscles, contributing to pelvic stability and efficiency in everyday and sports movements. This enhances blood flow and lymphatic drainage, and also transmits stimulus to the pelvic bones via the sacroiliac joint, so that when you spread your legs, this joint stretches and in turn stimulates the pelvic bones, making the pelvis more elastic. Through this bone-muscle interaction, the effect even reaches the internal organs, since ligaments around the entire circumference of the pelvic bones receive this tension and release nutrients and regenerative signals to neighboring structures. Rhythmic mobilization of the pelvic region plays an essential role in local circulation, as blood vessels benefit from the mechanical pumping generated by the contraction and relaxation of the adductor and abductor muscles, promoting greater tissue perfusion. The same occurs with the lymphatic system, which relies on external stimuli to drain excess fluid and efficiently eliminate toxins. Next, the gentle traction applied to the sacroiliac joint encourages optimal sliding between bony surfaces and maintains the integrity of the lower intervertebral disc, reducing the risk of compression or pinching. Considering pelvic biomechanics, when it opens in a controlled manner, the ligamentous fibers that surround the pelvic bones are stretched and replenished with new collagen, which supports the health of the sacroiliac and sacral joints, preventing stiffness and joint origin low back pain. Moreover, pelvic elasticity directly impacts the health of internal organs, as the pelvic floor muscles and the fascia lining the abdominal cavity are interconnected in a continuous network. When pelvic ligaments are stimulated by this opening and closing movement, they send proprioceptive impulses to the central nervous system, signaling pelvis position and creating a reflex response that adjusts tension in internal organs, such as the bladder, uterus, and rectum, ensuring they remain properly positioned and receive uniform blood flow. This cascade of stimuli enhances visceral function and may reduce symptoms of urinary dysfunction or abdominal discomfort. From a physiotherapy perspective, this protocol of alternating dynamic contractions with pendular stretches works in synergy with myofascial release techniques and deep core stabilization exercises. With each cycle of movement, the patient facilitates the removal of metabolites and inflammatory cells that, when accumulated, cause stiffness and pain. At the same time, the tension applied to pelvic ligaments stimulates mechanoreceptors that trigger the production of endogenous anti-inflammatory substances and tissue repair glycoproteins, improving local immune response. Consequently, greater range of motion is observed in flexibility tests such as pelvic tilt and the side-lying adduction test. To implement this method safely, it is recommended to start with 3 cycles of 20 to 30 butterfly repetitions, interspersed with pendulum stretching held for 60 seconds. As tolerance increases, you may gradually extend the number of repetitions or the stretch duration up to 3 minutes per cycle. It is essential to maintain trunk alignment and engage the core before each movement to avoid compensations in the lower back. If intense discomfort arises, stop the protocol and perform gentle pelvic mobilizations or manual compressions over the sacral area to release tension points. In the long term, with regular practice, this integrated exercise promotes greater endurance of the pelvic muscles, improved upright posture, and reduction of chronic lumbopelvic pain. Rehabilitation professionals report that patients who adopt a daily pelvic mobilization routine experience stability gains in everyday tasks such as walking, climbing stairs, and lifting heavy objects. Moreover, this approach aids athletes' functional preparation by enhancing force transfer to the lower limbs and improving performance in activities requiring quick changes of direction. Thus, the simple variation of moving the legs apart and together works in a chain, benefiting bones, joints, ligaments, muscles, and internal organs, proving to be a powerful strategy for integrative core, pelvic, and spinal health. The adductor muscles are naturally tense, and consequently, the internal ligaments remain under tension. So when you stretch the fascia and these muscles in this posture, the stretch is transmitted directly to the pelvic internal structures, making this exercise extremely effective in promoting joint mobility and deep flexibility. Beyond immediate mechanical benefits, this technique stimulates blood and lymphatic flow, contributing to cellular nutrition and toxin removal, while increasing pelvic ligament elasticity and improving support for internal organs. In my clinical and functional training experience, I find that the combination of sustained stretching and gentle contractions yields significant gains in pelvic core stability, reducing lower back pain and promoting more efficient postural alignment. To further intensify results, I suggest integrating dynamic variations, such as controlled leg openings at gradual angles while synchronizing diaphragmatic breathing with movement to optimize tissue oxygenation. By inhaling deeply during the opening phase and exhaling slowly upon returning to the initial position, we create a cycle of myofascial release and neuromuscular activation that enhances tissue regeneration. Recent exercise physiology studies show that this approach recruits both slow and fast-twitch muscle fibers simultaneously, accelerating adaptation and strengthening neuromuscular connections involved in pelvic control. Additionally, pairing this protocol with complementary stability techniques, such as front and side planks, promotes synergistic strengthening of the abdomen and deep trunk muscles, forming a more resilient abdominal belt and protecting the spine from overloads. Another valuable resource is self-massage of the adductor region using a foam roller before exercise, which softens tension points and improves the subsequent stretch response. This preparatory step enhances the protocol's effect and reduces micro-injury risk. For progressive development, I recommend starting with 3 sets of 30 seconds of sustained stretching, alternating with 30 repetitions of leg opening and closing, and gradually increasing to 60 seconds and 50 repetitions as tolerance improves. Keeping a training journal helps track range of motion gains and comfort levels, allowing fine-tuning of technique. In my Telegram community, I share daily advanced variations of this and other techniques aimed at pelvic work and visceral health, such as rhythmic oscillations in supine and isometric resistance exercises for the perineum, which complement the main protocol. These daily routines enable participants to observe improvements in urinary function, reduced pelvic tension symptoms, and a greater sense of overall well-being. Finally, I emphasize that consistency is key. Practicing these exercises 2 to 3 times per week, combined with a comprehensive core strengthening program and healthy lifestyle habits, such as proper hydration and a collagen and mineral-rich diet, will ensure not only a more mobile pelvis, but also a more balanced and resilient body for everyday demands and sports activities. Lie on your back on the floor with your knees bent and the soles of your feet together in a butterfly position. Begin by seeking a deep state of relaxation, as in a guided meditation. Allow your body to settle completely and simply observe how the muscle fibers and fascia on the inner thighs gently stretch. Hold this resting posture for a few moments until you feel the tissue starting to give way under the weight of your knees. Then begin the active cycle. Take a deep inhalation to stabilize your torso, and as you exhale slowly and with control, gently press your knees toward the floor, performing 30 to 50 rhythmic contractions. This alternation of passive stretching and active contraction efficiently warms up the adductor muscles, enhancing their pliability and preparing them for subsequent training stages. After completing the recommended repetitions, fully relax your legs and let them return to the resting butterfly position. To maximize the benefits of this protocol, incorporate myofascial release techniques before and after the exercise. Use a foam roller or myofascial release ball to gently glide along the inner thighs, focusing on areas of greatest tightness and spending at least 60 seconds on each side. This preparatory step reduces localized tension and enhances the effectiveness of the subsequent stretch. During the contraction phase, protect your spine by lightly engaging your core. Imagine an abdominal belt supporting your torso and preventing excessive hip tilt, thereby preserving lumbar integrity. On deep inhalation, create a diaphragmatic brace capable of absorbing mechanical stress. On exhalation, channel the air toward a conscious relaxation of the stretched muscles. Exercise physiology studies suggest that this combination of dynamic stretching and light isometry improves not only flexibility but also functional strength. Slow twitch fibers, type 1, are activated during sustained stretching, while fast twitch fibers, type 2, respond to the vigorous contractions, resulting in comprehensive neuromuscular stimulation. This is especially valuable for individuals seeking to prevent injury and enhance motor coordination. To progressively increase the challenge without using weights, try placing a light resistance band around your knees during the contractions. The added resistance will further recruit the hip and core stabilizers, strengthening the kinetic chain. The performance of this exercise also benefits from a strategic nutritional approach. Consuming a pre-workout snack containing high biological value protein and complex carbohydrates about 30 minutes before your session provides stable energy substrates and essential amino acids, delaying fatigue onset and supporting protein synthesis. After training, replenishing electrolytes and fluids with mineral-enriched water or homemade sports drinks aids cellular recovery and maintains plasma volume, accelerating the removal of metabolites. To integrate this protocol into a balanced routine, schedule 2 to 3 weekly sessions on non-consecutive days. Start with one cycle of 30 contractions followed by 20 seconds of butterfly rest, and gradually increase to 50 contractions and 60 seconds of rest per cycle as tolerance and range of motion improve. Track your progress by recording movement quality, comfort level, and perceived flexibility changes in a training journal. If any sharp pain occurs, stop immediately, apply local ice, and only resume practice once the discomfort has subsided. Finally, consider complementing this work with stability exercises like front and side planks, as well as quadruped pelvic mobilizations, to reinforce the core and optimize neuromuscular control. By combining myofascial release, passive stretching, active contractions, and global strengthening techniques, you will create a virtuous cycle of mobility, strength, and injury prevention that extends to muscles, fascia, ligaments, joints, and internal organs, promoting a state of lasting functional well-being. Close your eyes and allow your body to relax completely while you focus on the inner thigh stretch, feeling how the muscle fibers and fascia gradually lengthen in sync with your breathing. Inhale deeply, expanding your diaphragm, and as you exhale slowly and fully, gently Increase the outward motion of your knees toward the floor. This exhalation phase yields the greatest relaxation and myofascial stretch. With continued practice, you'll notice your muscles becoming progressively more pliable until you reach an ideal comfort point, where warmth and slight numbness signal increased blood flow and lymphatic activity in the pelvis. If at any moment you experience intense discomfort or burning, hold the posture for 1 to 2 minutes, then perform 30 to 50 quick butterfly contractions, inhaling on the contraction and exhaling slowly on release to warm the muscle fibers before returning to passive stretch. You may repeat this cycle up to 3 times to optimize local preparation and ensure connective tissue responds more effectively. Once repetitions are complete, rest again in the butterfly position, continuing mindful breathing, and observe the growing lightness in your pelvic region, indicating improved circulation and lymphatic drainage. This enhanced perfusion helps alleviate ligament tension pain, menstrual cramps, and chronic hip discomfort, as pelvic ligaments rich in collagen and elastin receive gentle mechanical stimulation that promotes tissue regeneration and hydrodynamic balance among body compartments. Beyond physical benefits, this protocol influences the autonomic nervous system, helping release emotional tensions lodged in the pelvic area, such as deep-seated fears, shame, or blocks around sexual expression, as conscious fascial stretch activates mechanoreceptors that trigger deep relaxation responses and ease psychophysiological restrictions. To amplify these effects, include a brief daily meditation with eyes closed, focusing on the energy flow between pelvic bones and internal organs, and use visualization techniques to imagine anatomical structures opening gently in time with your coordinated breathing. Next, add myofascial release sessions with a foam roller on the inner thighs for 60 seconds before each contraction and stretch cycle to reduce tension points and enhance fiber responsiveness. Integrating pelvic core isometric strengthening at the end, holding contractions for 20 seconds in front and side planks, ensures greater lumbar stability and prevents compensations that could compromise biomechanics. When performed 2 to 3 times weekly on alternate days, this toolkit not only improves flexibility and reduces pain, but also enhances proprioception, strengthens the pelvic floor, and optimizes visceral support, resulting in better posture, greater confidence in daily movements, and superior athletic performance. To track results, keep a practice journal noting your knee opening range, discomfort intensity, and perceived changes in emotional and physical well-being, gradually adjusting passive stretch duration up to 3 minutes per cycle and dynamic repetition count up to 50 as you progress ensures safe, effective advancement. If you find sitting uncomfortable, try performing the exercise while lying down or even watching your favorite show in bed, as the butterfly position can be maintained on any comfortable surface without losing therapeutic benefits. Finally, share these techniques with friends, family, and colleagues. Spreading body care practices is an act of empathy and collective well-being. Subscribe to my channel and join the community where I share new pelvic health routines daily, promoting a more balanced lifestyle because caring for the body and emotions is the first step to living with greater vitality and fulfillment. I confess that what struck me the most was the gentle warmth and lightness right after the deep breathing phase and passive stretching, almost as if my pelvis itself were being awakened from the inside out. It was in that moment that I felt not only an immediate release in the tension of my adductors, but also a subtle shift in my mental state, the sensation that each exhale carried away a bit of accumulated stress. I also noticed, after a few sessions, a real improvement in mobility. Getting up in the morning without that usual discomfort in my lower back and hip became almost trivial. And in my daily walks, I felt a renewed confidence in my movements, as if my own body had rediscovered a stability I didn't even remember existing. And you? Which of those moments was your click? Was it the warmth flowing through your pelvic region? The relief from hip or back pain? The new flexibility in your adductors? Or perhaps that feeling of security when performing simple tasks, like climbing stairs or carrying groceries? Share your story, your challenges, and what surprised you here in the comments. I read every account, and it's from them that the next content is crafted tailored specifically to what you really need. If this protocol has planted a seed of transformation in you, subscribe to the channel, hit the notification bell, and join our community. And to let us know you made it to the end, leave a comment with the word mobility. Let's grow together step by step because caring for the body and mind is an act of daily courage. I look forward to reading your story.